Here we go.
It's the good stuff.
So if you know what this song is, you probably have gray hair. Or no hair. Not that there's anything wrong with that. All right, welcome back to
gray, but it's coming.
With Chris and Mike D. I'm Mike Donahue.
I'm Chris Lyons.
And man, we've had a lot of fun here just with our first two episodes, speaking with some amazing founders and leaders, learning a lot about their journey and the trials and tribulations, the agony and defeat, the thrill of victory, to quote The Wild World of Sports. And if you know that, you're also old.
With Howard Cosell.
With Howard Cosell. I don't know if you've seen that meme with Howard Cosell. He had his picture taken with Bruce Jenner and O.J. Simpson. And it says, "What in the H happened?"
Yes.
So funny. Anyway, we're just going to continue our series here, talking to some thoughtful, innovative startup founders. These are the disruptors and agitators. And we are super excited to have our guest today. Chris, do you want to introduce him?
Absolutely. It's Dr. Ken Gall, along with the leadership who wasn't able to join of Kurt Jacobus. Literally some of the most powerful serial entrepreneurs that the industry has seen in the last 15 years.
Awesome.
With Restor3D, of course.
How's it going?
Good to see you all. Thank you for the applause. I know that song. It's a Van Halen Jump.
There you go.
So my hair is gray, but you can't see it.
That's what we love, brother. We're in the same boat. Let's go execute.
Like, Are you guys David Lee Roth Van Halen fans or not? Or what's the other guy's name?
Yeah, I think when you know where you sit.
Sammy Hagar. Sammy Hagar. Are you a Sammy Hagar or David Lee Roth Van Halen?
Oh, I think I'm David Lee Roth, but I don't know.
I'm going to go out on a limb and say David Lee, because that was the greatness. Sammy brought a different vibe, but that was the greatest.
Yeah,
I agree. I love the Ice Cream Man. That's probably my favorite Van Halen song. a little acoustic.
Yep.
Okay. That's a good one. Well, Ken, thanks for joining us, man. Thanks for taking some time. We like to kind of get into some discussions with our founders and let you introduce yourself. And we'd really like to hear, Chris mentioned you were a serial entrepreneur, which I assume means you haven't invented a bunch of cereal, although that would be cool if you did. I'm interested in hearing about some of the companies that you started. Let's start with that and then go from there. Talk about that, your history in entrepreneurship.
And their origination in a lot of cases, university-wise.
Yeah, no problem. Thank you both for being on here, having me on here. I appreciate the opportunity. I'll start. I was a classically trained academic. So I actually really came out, got a PhD in mechanical engineering. I actually started in nuclear weapons design at a place called Sandia National Labs.
Oh, wow.
Right across the street from Lawrence Livermore Labs, which I think the current Smith & Nephew CEO was at, also the same lab. And so I was in this mechanics area and took a job at UC Boulder. My first kind of job out of doing PhD and then into this weapons design thing. I was working on the stealth bomber. And then decided, I got there and I started working on nitinol, which was a shape memory alloy as part of my PhD thesis. And I distinctly remember I was going down this regular academic path and sitting there doing papers and teaching students. And I loved all of it. I loved working with the students, young minds, and people growing and doing things. And I started thinking there's a lot of applications of nitinol that are being used in cardiovascular stents. They were all just starting to come out. A company called Guidant was doing it. Eventually became Abbott Labs, and all these were coming out. And I was writing a paper. I remember distinctly at one day thinking, I was saying, well, there's all these applications in orthopedics and all these things. And I had noticed a company called BME was recently founded, I think around that time frame, and Mimo Metal. And then I started to think, well, if I write this in these papers, what's going to happen? Like, is someone going to pick up this paper and go do it? Or then that's going to piss me off, right? Big idea. Or is nobody going to do it? And that was really depressing. So I thought, why don't I try to do it? If I think this is a good material? And so decided in 2004 timeframe, after I had my PhD was in 98. So it was a couple of years after I just gotten tenured at Colorado, decided to form a business that was going to try to commercialize shape memory alloys. And that was my start. That was how I did it. And I can tell you a couple things. You all mentioned just about spinning things out of the university, and that I'll tell you a little about that and see if you have other thoughts on that. But it was definitely at Colorado a little bit of a tough process. We had a couple different patents. They had this system where they would like decide if they had value, like they do this and that. And it turns out the ones they thought would have value never issued and turned out to be garbage. And the one that they didn't, that they gave us back. They're like, oh, we have this thing has zero value. It was a patent on an intramedullary nail made out of nitinol. And
Oh,
like,
wow.
it's going to have zero value. And so they gave it back to us. The university decided that was it. And so that was a little bit of a tough process, just trying to spin things out and get terms. And I had kind of learned my first lessons in there and how hard it was to do things, spin things out of university.
So when you say terms, was it just negotiating the license to the IP, or were there other factors to consider? And did you discuss ownership in the company, or was it strictly royalty and IP license?
Well, universities generally, I've worked at them for a long time, and I'm always good things to say about them generally. There's a lot of bright minds there. They don't really start businesses themselves. They don't understand generally the things. So they want everything. They generally want to have ownership in the business. So they're there at the foundational level of equity, but they also want to have royalty. Like it's stuff just skimming cash off the top. And those two things are a little bit counterbalancing because you're taking cash when you need cash to build the business. So they're hurting their equity position, but none of that matters.
Right.
Then they had weird clauses. I remember in our first agreement with Colorado, I've learned since then, by the way, I think, and Duke is much better at this now, fast forwarding to now, Duke has a great office and I've worked well with them. I learned, for example, they also had consent rights, and I'll never forget because one of the early days of MedShape, we partnered with a company called ArthroCare, which I think eventually bought by Smith & Nephew. We had an early partnership and ArthroCare was ready to sign the deal. Now imagine how slow a large company is, and it takes a long time to get a deal going, right? ArthroCare was medium sized. They were a little faster.
Right.
University was way slower, so slow that the CEO and I at the time went to the university and sat in the tech transfer office and said, we're not leaving until you sign this document. It was absolutely ridiculous. And so we sat there and they signed it. So I learned my first lesson there, which is don't give them consent on anything. It's too slow. I became more advanced from there into things. And they'll ask for everything. You've got to push back in those early days.
So you have to be prepared early. And it's probably a good idea, particularly if you haven't done this before, to maybe seek out some expert opinions from consultants or somebody like that to help you guide those delicate discussions. Because to your point, you might give up both equity and you're right, if they're skimming cash out of the business, then they are actually hurting their own chances of a successful exit.
Yeah. I mean, it's cash at the most critical time. Right?
Yeah.
The business is not cash flow positive. So every $10,000 is something you could be spending on development. And we were all incented. We didn't have big salaries. In fact, we had zero salaries at the time. Kurt Jacobus, who's now I've worked with for 20 years, became the CEO of that business. It was the one I went back to the CU to get the license. Because in 2005, I moved the business from Colorado to Atlanta. So I moved to become a professor at Georgia Tech. Started that in 2005, and I stayed there until 2015, and then moved to Duke in 2015. But recruited Kurt because he and I were lab mates, and I always thought he was much smarter than me. So I thought he'd be a perfect CEO to run this thing. And I didn't want to run it. I wanted to stay on the technology side. And he came in and ran, and I think we learned a lot of lessons about how to work with universities, and we changed that in our next business.
And not only that, I think too that one of your points is for any of the companies that are created out of the technology, out of the IP that may come out of university, I think the universities sometimes may be blind to the fact that relationship, once it gets to a strategic exit, is going to be severed if it hadn't been already.
Correct. Yeah, I've been a part of a couple different acquisitions. When MedShape was ultimately acquired in 2021 by Innovis. And then when I moved to Georgia Tech, I founded a business called Vertera. That's one that Chris and I met over. That was a small spine business that ultimately was bought by NuVasive. And we did things differently on the IP with Georgia Tech. I noticed there was I don't call it a loophole, but like if you developed IP with a grad student and an undergrad, the grad student and you had to assign your IP to the university, but the undergrad did not.
Oh, it's interesting.
So when we founded Vertera, and it wasn't me trying to do something, Georgia Tech was a great university, a lot of good things for me, and I think for me, for them too. We had the IP was actually the undergrad, me and the grad student. So we assigned ours to their licensed. We went to go license it from Georgia Tech, but we actually first licensed it from the undergrad. So, and I saw his name's Daniel. I saw he was out here not too long ago. He's now a orthopedic, I think, med student or resident. So he went all the way through after all that. And so he actually, that business ultimately sold. So he made some money off the deal. So it was all good for him. But that allowed us to go back to the university and negotiate in a reasonable way. We said, look, we already have a license to this technology. We're going to ask you for exclusivity. So we're not taking all these ridiculous terms. So, and then that made the negotiation much cleaner.
Okay.
Georgia Tech got something out of it. We got something, but that was because we already had a license to it from the undergrad who developed it too.
That's great.
Fascinating story.
It is a great story.
Yeah.
Yeah. So, and he did well. And the university made an odd move, though. I think second round in, they sold their IP, which turned out to be a bad timing for them. We offered them, I think, a certain amount of money to buy their IP position out. They had equity, and we bought them out. And then we didn't know this, but about 8 months later, we sold the business for a higher price. But that was not something we did on purpose. It just happened to happen that way. University, sometimes they'll take an exit ramp early if they can get the cash out.
Hi, listeners. As a medtech leader, you know how hard it is to scale up your sales team and prepare them for a successful product launch. If your reps are still digging through cumbersome shared drives and web portals, clicking through an LMS that no one uses, or relying on email newsletters to stay current, it's time for a change. Your reps, they're on the move. They need on-the-go content and a single source of truth. And that's where Convey Connect comes in. It's a mobile-first, company-branded app that gives your sales team instant access to training, sales tools, and company updates all in one place. At Convey Connect, we can have your customized, white-labeled mobile app deployed to the app stores in just a few weeks, so your sales team is resourced and aligned to win. So if you're scaling your team or prepping for a big launch, please check out conveymed.io. Schedule a quick demo. We would love to show it to you. So now back to the show.
Do you think they have long-term vision relative to that whole process, or do you think that's just something that's missing?
At university,
it's more about what I can get now.
We have a person here named Robin Razor who runs Duke's office, and she's definitely thinking both strategically and long-term. I think she thinks about stuff in a really good way. I would say that one of the problems they face, and she's upfront about this too, is the drug licenses or these other things are just so dominating on their budgets, right? Like if they have a license to, I think Duke had a couple drugs around licensed to big pharma companies, they're generating 20, 30 million a year in revenue. And it's hard, even in orthopedics, if you had a partial ownership to get that much out of it, even the exit would be hard, right?
Right.
You got a couple % ownership, that's still a big exit, right? To get to that. And think about this, they're getting this every year. So a lot of their models are developed off these drug things because it's just so dominating stream of revenue for them.
Oh, it's such a massive stream of revenue. Yeah.
Device. It's
the different order of magnitude.
Yeah. So they try to think about, to your question, Chris, the future and what do they play a long game there? They've also had a lot of trouble with companies that have founded, given them equity and then died, or become these walking dead startups where it's just like they're surviving, but they're going nowhere. They're not going to exit. They're all over the place.
Talk to us a little bit about, you've done this a few times. I know you're involved with a number of companies, not just Restor3D, how you've had the companies funded. What's been your fundraising strategy? Did you live off of non-dilutive funding for a while and then go out to market? Or tell us a little bit about that, maybe your experience with MedShape, and if you want to weave in your current experience with Restor3D, that might be helpful too.
Yeah. Thanks for the question. Yeah, it's a great question. People either find my thing interesting or have zero use for it because I've taken a totally different path for fundraising. We do non-dilutive grants, so SBIR, STTR, NIH, National Science Foundation, National Institute of Health. They're tough. They're slow. They They don't come in when you need them to come in. They seem to always come in when you don't really want them to come in. So I think MedShape, we had $6 or $7 million. I'm involved in a company called Resolute, which is doing antibiotic eluting nails that we've got some federal funding. Vertera had none. Every grant we applied for got rejected. I think we had maybe a small one. We've done a little bit at Restor3D, but the federal funding, we were growing so fast that the federal funding, we outstripped it pretty quick.
Yeah.
And so, which is a good problem to have, but still. So my approach to fundraising has been 100% angels. I've not used VCs, and I've found that over the years, the VCs have definitely shifted, especially in orthopedics, to almost what private equity used to be doing. Like they come in really late, or they want to have some revenue, and however you got there doesn't matter to them. It's usually happened through some recapitalization, either of a angel rounds or some other VC that put in money early. And you see this in the really great exits recently too, right? If you think of like Artelon or BioRes,
Sure,
Crossroads, these are all big exits that were recapitalized by VC essentially, right? At some point.
Yeah.
Great companies, great products. So we've actually done all private angels, and we have the reason we've got angels to come back is we make them money by selecting reasonably low valuations and having very systematically growing valuations. So I'll just be upfront as possible. Here, Restor3D, our first valuation, our fundraise, $1 million. And so people don't think that way. They worry about dilution or worry about this. I think about the next round. So I think we probably moved from $1 million valuation to a couple million to 5 to 10 to 20.
That's the way to do it.
And I think with angels particularly, they want to see a steady increase in value and feel comfortable they're coming back in. So we've had some talks with some good VCs in the ortho space. You have like Health Point Capital. We've had a lot of discussions, and we've been talking recently to some with Restor3D because we're looking at really large investment levels. But just to give you an idea, Restor3D, we've raised over 100 million from private angels. So
wow.
Not insignificant.
That's so impressive
Amount of money. So we have a really good network of people that goes, and that you have, I can't disclose all the different people that are in there, but it's people that know orthopedics and know med device, and then just some household names and people that have made money in other areas.
So what advice would you give? I think there's a pride issue that happens with a lot of startups. And that pride issue comes in the form of, well, I've run my models and so on and so forth. And it's telling me that if I play this out for the next 5 years, that my net present value is this amount. And I think they hang on to that, and they don't want to be called $1 million valuation. Is that the thing that is, because it's going to come back and bite them. There's no doubt about that. But,
100% agree. I advise a lot of businesses, and I do try to get them to think reasonable about their valuations. I think some of it's pride. They see that. A lot of it's dilution. They're worried about how much they own of the business. And I don't know. I do care myself about making a return, and I'm an investor in many businesses and do want these things. But I also think that when you're going out to find angels, you want to have, these are people, you want them to make money too. And so you've got to be able to share. Our shareholder base at Restor3D is founders, employees, key people that know the industry, and then just a bunch of high net worth people. And everyone there's got to do well. The employees, us, the founders, the other individuals. And so we've tried to set values that have been reasonable. I think people just always start too high. I have for a 510K device, this is one of my rules, like kind of general rules of thumb. It doesn't feel good, but like I feel like when you hit $1 million in revenue, you don't want your valuation to be too much higher than 10 million, because you're already at a 10-to-1 multiple, and you're going to start getting judged on your revenue, and you got to be careful. And so we try to stick to that. It might be off a little. We try to raise our first rounds. If we're going to go for a 510K clearance in something, we try to raise our first rounds at $4 or $5 million values, or 2 or 3 million. Get the 510K. Again, this is for a 510K. So I'm involved in some businesses with Novo or clinicals that you're not going to have that valuation. But
right.
I think people want to have a 510K based business with valuations that start at 10 to 15 million, and you're upside down before you know it.
Huh.
Very true. Especially if the revenue channel doesn't play out the way you think it's going to.
Yeah.
And the fact that there's more barriers today than there was 15 years ago to accomplish that revenue channel.
Correct. And then one thing I'll mention too is people talk a lot about the big exits and the different things, but we don't often hear about how did people do that were in the first round. Like there's probably, because that's what you get pitched a lot, right? Is here's coming in this early round. And especially these companies that are recapitalized or have down rounds. So those first rounds, you take enormous risk and at those high values and you get burned, right? And so I really don't come into businesses myself as an investor if the beginning of them is above $5 million value. And I'm okay with coming back, but like I said, at Restore, we started even lower.
Yeah. Great plan.
That's interesting. Yeah, it seems counterintuitive to a founder who wants to. You're right. I think it's a pride issue.
Yeah, they want to keep it. You're trying to hold your value and stuff. But look, if the company performs and you're a founder, you can still build yourself. You can have an equity incentive plan. You can get other shares. You can still earn more equity back as you do it. It's just, I do run into a lot of founders that want to keep a certain percentage or keep control. And man, it's tough. It's just, there are so many things that can go wrong. Just an example of maybe one of the most major mistakes I made as a young founder. So when MedShape started, I was adamantly against anything Me Too. I'm like, we are going to make the most unique product ever, and that's it. We're going to build a Ferrari. And I wanted that Ferrari to be perfect. And so we chose Ankle Fusion, or TTC Fusion, which was a small market. You're talking the $70, $80 million market. But I'm like, we're going to make a nail that actually can change its length autonomously in the body, help these things heal. And we got there. We created this incredible device. It had great clinical data. It's now become a real flagship. Companies have tried to copy it. And so it's really changed the game in that thing. But being a small market, it was tough, right?
Yeah.
There wasn't a clear pipeline. Companies wanted to buy it, but well, can I use this anywhere else? And so the thing that I definitely was really negative on were staples, like little orthopedic staples. I was like, no, I'm not doing this. I'm like, BME's doing this. Mimo Metal just got bought by Stryker, I think, around that time frame. And I said, I'm not interested in any Me Too stuff. And I fought that for way too long. And eventually we made staples. And the first year we made them, we probably did 3 or 4 million in revenue, which took us like 8 years to get the Dynanail to that. So there's a lesson in having both the Ferrari and maybe something else to sell too, that really stuck with me for a long time. You got to be careful. And that means different things in different businesses. Like maybe you sell ancillary stuff too, to make some revenue, or maybe you have multiple product lines, but it's hard to survive. That might be different in maybe a cardiovascular business where you can just do a PMA, release one product and go sell it.
Right.
But in ortho, that's tough. You don't have a pipeline. You don't have other stuff that's easy to fly off the shelf. It's hard to survive. And so that was one thing we changed when we built Restor3D.
Yeah, it's interesting. It's like a portfolio approach. And in that case, it sounds like you went for, we need revenue. Let's get some revenue, because the cheapest form of fundraising is revenue.
Right.
Yeah.
It's non-dilutive, and it helps you grow your company. And so that's the best way to fund your company, is through revenue.
Yeah. And sometimes I underestimated. I was a green PhD that knew everything. I underestimated the importance of the sales channel, the distributors. I didn't understand things as simple as, well, this distributor is making 30 points. They're never going to sell your product unless you give them 35. I just didn't know any of that stuff. So as I came into spine too, as you all remember, all the physician-owned distributorships stuff, that even complicated things more.
Oh, yeah.
And so I just didn't think, I thought, well, we got the best technology. Let's start using it. It took longer. I also underestimated the importance of instruments. Like, we had the absolute best implant on the planet, but I made some bad choices around the instrumentation that cost us some time. And those were painful things long-term, but long-term worked out.
So when you think about that, let's talk about instruments just for a second. How many iterations did you guys have to go through before you landed on what stuck?
Yeah. A lot. In the case of the Dynanail, we didn't have the financial resource to keep iterating. So we were building all this feedback. So we probably would have been through 5 iterations, but we built all this feedback. And then by 2017, we just released a new instrument set. And the sales just took off. Yeah. And we also released some clinical data that same year. I used to think it was the clinical data, but I'm starting to believe now that the actual It was the instruments that led to
Mhm.
the increase. And then that ultimately, we really started growing that product. We started to own that market and eventually release smaller versions of it and all this. But it was we're talking like a 5-year process and one big iteration.
Yeah.
Not the cycle I would recommend to people. Probably do more of a soft launch over a 3 to 18-month window, do an iteration and maybe a Gen 2 after
Yes.
3-4 years. But we're exploring. We can talk a little about Restor3D, but we've mastered the ability to make patient-specific implants. But we have a secret covert project on ability to print instruments, because instruments is still a massive problem.
Yes,
Like
it is.
When you say problem, just they're not good, or they're expensive to make, or it's
Oh,
asset heavy, or all the above.
Adoption.
Yes. So all these things, and I'm talking about reusable instruments. So we print a lot of patient-specific disposable instruments. That's easy. For us. So we're doing that all the time. So we make a patient-specific implant, print patient-specific instruments, but there's still a basket of some reusable stuff that we use, and it's everything. Surgeons want changes. They want custom parts to that. Our supply chain is slow. It takes a long time to get them. We might have ones that don't work and we just need a quick fix. We got to change something. And there's always like, you can't just put a hole here. And so it's really just slow, stagnant in a space that people want it to be fast and changing. And that's why we've realized, I think we just this last couple months ago kicked off a project to figure out if there was a cost-effective way to print 17.4 instruments and just really put this whole problem to bed. And I think we've got some amazing prototypes. There's some new printing methods that are low enough cost that we can go in any batch we want. Then because when you think of medical instruments, they're reasonably sized, so printing can handle them. They've got cuts and sharp edges and things for cutting tools, but that can be printed nowadays. And then some of these newer techniques have good surface finishes, and your batches are not that big. If you launch it, the problem is you're not making 1 million parts. If you launch with 100 sets, you're making 100.
Exactly.
And so printing is actually a really good approach to that. It's just not something we've started, but we're starting now.
And you guys, you're vertically integrated, right? Within Restore?
Yep. Yeah. So we literally start, we have powder and resin, either metal or polymer powder and a resin. And it fits in a room not much bigger than I'm in here, a 10 by 20 room for probably 100 million in revenue. And we start with that stuff and we go all the way to the final parts in-house. So part of what got us going as a company is we were COVID, baby. We were founded right before COVID. We literally, our first cases, and then we had no supply chain problems at all. We had nothing we also had all the complex cases were still happening. And as a business, that was our initial focus, was complex cases. And so we really grew during that window, COVID period. It enabled, not that it was a good thing for everybody, but it was ultimately good in that we were able to provide stuff for these complex cases still during the pandemic.
Yeah, definitely.
Talk a little bit about your portfolio sequencing. Like, what did you come out with first at Restor3D? And what was the thought process for how you rolled out you have rolled out, and it sounds like you will be rolling out future pipeline. Give us some insight into that.
Yeah, it's great. Yeah, thank you. So I'll just backing up even a couple of years, in 2013-ish timeframe, when we were launching the Dynanail MedShape, it was a TTC fusion nail. We started getting a lot of these cases where there was just a massive piece of the tibia missing, the distal tibia. And 4Web was coming out. I think they came out around 2015 or so, but there's people starting to do these cages because the grafts were just dying. You just put them in there. Even our nail would just compress everything. The graft would die, and you got a 3 centimeters defect. There's nothing you could do, right? And then the nail breaks, and then you're done. And we started getting a lot of requests for these, and I thought we could 3D print these things customized. And then I noticed 4Web started to do that for some of these and others. And so we decided to start looking at a basic research to found a business where we could go after complex cases cost effectively that included a lot of bone void defects and things. And the one thing I didn't love about the 4Web structures at the time, there were these big open trusses. And I was like, I don't think that's the most osseointegrative structure. Like, there's this sort of theory of like, should you minimize the amount of metal or not? And we've done a lot of basic research on this topic. You don't want to minimize the amount of metal. That's not the right answer. You don't want to maximize it either. You just put a solid block in there. There's some optimal. And so better structures than trusses. And so we did all this research to figure out the right things to print. And then, Mike, to your question, we started the business by doing just complex cases. So just anywhere in the body, you have certain restrictions on. We were doing 520Bs and outside 510Ks, and we just doing really complex things that surgeons prescribed and said, we have no other option for this. And
so like nasty revisions,
Yep.
osteolytic hips or bad knees,
Yep.
ruined ankles,
Yep. And
maybe some oncology.
Correct. Yep.
Yeah.
And some other companies are doing that kind of stuff too. So there was a company called Additive Orthopedics that I think was bought by Paragon. Webb is doing some, and they're part of Stryker. Oncos is doing some of the oncology side. So, some other people that have looked into this space too, and are either were acquired or growing. The one difference for us was we were pretty technology centered, and I wanted to start with complex cases, but everywhere in the body. And this definitely drove some of our people nuts, because they're like, we can't sell everything around the body. Like, the channels are different, all this. And I said, that's fine. I don't care. We're going to try and build something where we can do hips and knees and shoulders and ankles. And the engineering shouldn't be that different. If they need these cases, they'll come to us anyway. And it was tough at first. Like, people it wasn't a model people were used to. If you think of an orthopedic company, they're always one channel. They're like, well, I'm going to start and build my widget in foot and ankle, and then grow my foot and ankle portfolio to get channel leverage. And we just didn't use that approach. We were totally the opposite. And in the background, what we've been doing was we started this to the point of sequencing. We started buying companies that had brought us the other parts of the technology. So you can almost think of, if it was like, if we were a electric vehicle company, we had the best batteries. Like, we knew how to do all the core battery and powertrain, but we started buying these other parts. So we bought a total ankle company called Kinos. That brought us a total. It wasn't printed at the time, but then we converted that to printing, and now we're doing the full launch of that product a couple of years later. We bought a total shoulder company that was owned by Doug Kors, kind of a former Tournier CEO. We then bought a Conformis, which was a hip and knee company. None of those companies had 3D printed cleared joints. They all had personalization of some degree. And so what we did is we married our sort of best battery technology, our 3D printing, with those joints. They already had forms of personalization and created the right marriage. And in doing so, that's how we've sequenced. So we're right about this year, we're about to launch really big products in the shoulder and ankle. So we have 2 really cool systems going. And then in a couple of years, we're going to launch out hip and knee. We're going to launch out hip and knee. Conformis had great products. They were just really expensive to make.
Right.
And we fixed that. So we've slashed their prices massively, their cost of goods. And so that's the way we came out with the sequence, if that makes sense.
Totally. But to that point, I think the audience would really appreciate understanding the percentage of the personalization products that you guys sell, percentage of revenue, versus the off the shelf. I think they might be surprised.
Yeah, it's a good question. I think there's sometimes our kind of main thing is we start with the anatomy. So we bring in a patient scan. We then tell the surgeon, all right, based on the scan, and this is where we're headed in all the verticals, you can use off the shelf, or maybe you need something special, slightly different here in the patient specific, or you got a real problem. You got a huge defect and you need a real ridiculous custom. So we're actually treating it pathology and then also surgeon dependent, because not every surgeon doesn't look at those 3 pathologies and pick the same thing.
Right.
We have a huge database of past cases too, so we can tell them we know what's worked in the past. So having said that, Chris, to directly answer your question, it varies. So in hip, we offer personalization, but we sell probably 70% off the shelf. Like, they don't choose the personalized option as much. In the ankle, we are probably 5% off the shelf, and much of it is personalized. Shoulder, we only have a custom offering right now, so everything's customized.
Yep.
We expect in the shoulder there'll be a balance there. There might be a certain fraction off the shelf. And so our systems, the way they work in all of our verticals, is we have a common instrument set that works across. So we take in the CT scan, we give the surgeon, they have their instruments, and they have some off-the-shelf options, but then they have the choice to personalize. And we let the surgeons decide the anatomy, decide and go from there. So it's not about saying everything has to be personalized.
That's great. Thank you for answering that.
Yeah.
There's a lot of anatomical variability, but there's also some ratios that are probably pretty close to each other. So you don't have to go all custom.
Correct.
But and I'm really interested to hear about your manufacturing, your sort of fully verticalized manufacturing, because I think that creates interesting value, I think, that the other companies don't have. Not just that you've created amazing products, but the way that you have reduced the supply chain risk. Super interesting. I don't think people are thinking about that in the industry.
No, they're not. And they're moving a lot towards printing, but they're not, they're applying the same model they used with outsourced manufacturing to printing. So they're like, all right, we're going to outsource everything. And we do outsource. We have some suppliers that produce parts for us because we mix and match customization and off the shelf, right? So you might do a patient specific glenoid, but off the shelf, glenoid base plate, but an off the shelf humeral stem.
Yep.
And so we're mixing. So some of that stuff is off the shelf. So we do have some inventory burden. We're not at zero, but we're a lot lower than big companies. And I think that the big companies haven't thought about, or traditional players, they're so ingrained in their sort of classic off the shelf model. They don't see as much benefit to bringing it in-house because it's all just a COGS play. They're like, well, how do I minimize COGS so that I can spend as much on sales and marketing as possible, right? And that's just the traditional ortho model. Yeah, we're a little more like a tech company. If you look at our numbers, like our COGS are a little higher, but our sales and marketing spends a little lower. And if you look at the big tech giants, they're more like that. We spend a lot on technology, a lot on manufacturing the most elite parts we can and products, and a little bit less on the sizzle of marketing that stuff. So that's where, and I think to do that, sorry, as a long-winded point, to do that, you have to have in-house manufacturing.
Right.
We don't have the time frame. Stryker, to their advantage, they've invested in it, right? They've gone pretty heavy. And I think between that and the Right Medical acquisition and the Mako, they've really been hurting the other big players. Yeah. And I think the printing side's one of the things they've done that has done that.
I'm curious to hear about the sales process for, let's call it your personalized approach, right? You're selling something different. You're selling a more personalized solution, whether it's for the hip, knee, or the shoulder, or the ankle, compared to Stryker, for example, who's the big dog in total ankle replacement. What's the sales process like, and how do you convince not just surgeons, but the whole decision-making group in thinking through even value analysis?
Yep.
How do you convince them? What is your story, and how do you move hearts and minds towards something like Restor3D?
Yeah, interestingly enough, we start generally with complex cases. So I think I was looking, we tripled our total ankle users this last year, and that's going to go up even more. Some of the launches we have coming. And in tripling that, 60% of those new surgeons did a complex case with us first. So we get in there, and those complex cases bill out for high prices, but then we don't stay with that. So that's only if there's no other option. We then go on par with pricing. So we get around the value analysis because you're just toast there. We sold Dynanail. That's another mistake I wouldn't remake, is Dynanail was a premium price product. We were selling it for $12,000. Everyone else was at $8,000 or $3,000 if you're Synthes. And I wouldn't do that again. It just took forever to get market traction, right? 10,000. There's value analysis people I met that were like, yeah, I heard about your product. I rejected it.
Sell volume, not premium.
Yeah. You got to be reasonable. So in the total shoulder, if we do a complex case no one else can handle, yes, we'll demand a premium because there's no option. But our patient-specific shoulder that we'll launch this year will be sold at the same price as regular.
It makes it fun.
It's not any more expensive for us to make. So we're saying our costs are the same.
Yeah, and I think some of our other guests have bemoaned it, and we don't want to throw value analysis under the bus because they serve an important role, right? However, the challenge that the big strategic companies have is that they'll sign them up for 80, 90% compliance, and you're fighting with all the other innovators for the other 10%.
Yeah.
So how have you been able to crack that egg a little bit?
Is it still the lead of the custom implant to go way over here to the right, and then you get the rest of the business?
Yeah. We get in there We get in there as a small one-off user and then build the rest. And we do have some others. Interestingly enough, I tell you, we go all the way from off the shelf to pre-planned into patient-specific instruments, patient-specific implants, crazy customs. Sometimes we enter the market in an area with off the shelf. Like we just had a surgeon that works well with a distributor, likes the reps, likes the process. Our off-the-shelf products do have advantages. I'll just give an example. Like we have the only ankle system that interoperatively you can change the constraint levels. Like right now, we can't do that today. We will have a system where we can come in anterior for a total ankle system that can't be done for a modular stem. So we do have advantages of our off-the-shelf system. So we will enter there if that's where the surgeon wants to. But the nice thing is, this is what I love. This is what makes me most excited about our model. They learn an instrument set that if they have a complex case, we give them the exact same instruments with additional patient specific, or vice versa. We bring them in on the complex cases. They learn our instrument set. They learn to like what we have. They can do everyday cases.
Exactly.
So there's no
smart.
They've tried the craziest, so the rest should all just fall into place.
Yes. So in that sense, it's really the option for personalization we're selling surgeons, not necessarily that you have to use it on every case.
Right.
It's that we will handle it. And it is a spectrum. People, it's not black and white. It's not like there's only super complex and super simple. Like the human anatomy is crazy. It's as unique as our faces. It's just a spectrum across things. And there's reasons to personalize in the middle too.
Absolutely.
Well, Ken, you've been very gracious with your time. Chris, do you have a final question for Ken?
Yeah, I would have just one more. In this day and age where we'll call it your father's custom implants that have been around forever and a day, and each of the big strategics had their own customs department, how do you differentiate your 21st century technology so that people see it truly as personalization? That's the big buzzword now when it comes to implant technology. Even to the point of how do you help the big strategics quit thinking the way that we used to think?
Yeah, no, it's a great question. I think some of them have been through the old school customs, and you know what happened there, right? It was everyone was trying to circumvent some of the 510Ks, and they were trying to make out these customs, and they were like, oh, let's just make it a service to the surgeons. But it was very unprofitable. It was annoying. And I remember talking to the CEO of NuVasive, and he's like, I hate our customs department. It's just like, the reason we're different is we were built from the ground up to do these things. Not only are we helping patients that need help, they're very profitable entities for our business, and we're bringing very advanced technologies into them. And so, especially when we start moving from a really strong custom into a patient-specific implant, which is a cleared implant, one below that didn't exist when the old school companies were doing customs. They saw no end to it. They're like, it's either off the shelf or super custom.
Right.
And that you can't, our business is seamless. Like we can actually do patient-specific clearance and do small modifications. And you know how surgeons are, they're dying for that. Like they don't like that. You go to one surgeon, like, I don't like this chamfer here. I don't like this. You can never do anything with that. Right. So I think to the big companies, well, I don't want them to like it really, actually, because we're having a good time working on their surgeons.
Right, exactly.
To some degree, the fact they've been slow to adopt this, I think some of them are starting to understand that this is where things are going. And you hear a lot of talk about AI too, for example, like we're going to use AI to make decisions about surgeries and this and the implant data. But like my question is always like, well, what if the AI tells you that certain implants work better for certain people, or you need implant changes? How are you going to adapt to that?
That's
like
correct.
You're selling the same product. Like we are implant companies. We sell implants. And even if you've got a robot to put it in differently, which we believe in, I believe navigation robotics is an area we'll be into and is exciting, but you can't change your implant. You can't offer something different. If you know that, let's just say the AI tells you that patients over 300 pounds that are 6'4" tend to have failures in total ankle because the sizes don't fit them right and they always subside. What do you do? Like,
right.
You got to be able to change the implant. And so that's what we're setting ourselves up for eventually.
So you definitely see a direct connection between personalization and the AI element.
Yeah. We use a bunch of it to design our implants. We haven't talked much about that, but all of our stuff's automated. Like we get a CT scan in And there's automated programs that use AI to segment, place screws, do things based on past cases. And then we send the implant to the printers, and that's automatically printed. So that's what makes us economical. If you look at our margins are going to be this year in the 67, 68% range for probably 90% personalized implants. You can compare that to like Conformis was in the 30% range.
Wow.
So yeah, we're in a totally different stratosphere where this is possible now.
That's great.
Yeah, that's amazing actually. Yeah.
Yeah, it's cool. It's cool to see. It really is the technologies, and that's what's really been exciting for me. I'm a technologist at heart, so it's been fun to see these automation technologies and things that used to take us 8 hours take 8 minutes. And that opens this door to start making personalization widespread.
Yeah.
Right.
And at the level that you guys are at, this is my last thing. At the level you guys are at from a revenue standpoint, from a awareness standpoint, are you running all of this off of how many printers?
Oh, pretty small number. We have just talking about the implant side, we have probably about 7 or 8, and we've constantly upgraded them. We moved to the newest printers. So we have quad lasers, things that are print overnight now.
That's awesome.
That's amazing.
I just think these are dynamic points relative to the size of the business, to the reach of the business. And I think it's going to give a lot of confidence to the listeners, especially those that may just be starting out, or they're sitting here asking the questions you were asking yourself back when you were at MedShape.
Right.
Yeah. Agreed.
Excellent. Well, Ken, thanks so much for your time. It was great to have you. There's so much more we could get into, but.
Well, thank you. We'll have to come back sometime.
Yeah, for sure. So yeah, we'll give you a round of applause. Yeah. Where can people go to learn more about Restor3D? And
yeah, www.restor3d.com. RESTOR3D. So it's like restored, but the E is replaced with a D.
Gotcha. And your URL is 3D printed.
Yeah, that's right.
That's awesome.
All right. Thanks, Ken. Thanks so much. Well, thanks for listening, everybody, to another amazing episode of the MedTech Jam Session with Chris and Mike D. And thanks for Ken Gall for his time. And we will see you next time.
Thank you.